So it's just say hello to everybody on Instagram as well. So
YouTube.
I'll also mention as much as I can about food and tips that will from the kitchen. And don't let me forget Epsom salts baths. I'm a great believer in Epsom salts for magnesium and for loosening out and heat and just minding ourselves. So that's a good place to start. So I hope I'll deliver all of that, and I'll come back to some of it at the end. I'm not going to go into a whole thing of what is osteoporosis. I reckon you all know what it is if you are tuning in tonight. It's age-related joint pain. Some people get more than others. It's also related to injury. So if it's an isolated joint related to an old injury, it kind of fits a different pattern. It's associated with reduced function, misery, chronic pain, and eventually kind of loss of dignity as you hand over various things to be opened by other people, and you wonder how you ever got to the situation of one of my patients who was walking down the stairs backwards. And that one, when it comes to dignity and osteoarthritis, she's somebody that I will never forget. After about 3 months on the herbs, she was still complaining of pain, but when I asked her how she was getting down the stairs, she said, "What do you mean getting down the stairs?" And I said, "Well, you were walking down the stairs backwards." And it's only then that she remembered. So it's a good idea to keep a diary of what you can do or can't do, how much pain you have, how much painkillers you're using, because I can't guarantee that you'll be pain-free, but an improvement, maintenance, and halting the disimprovement is a pretty good goal and objective. I'm going to start with what herbs I personally recommend, only because I have to recommend some combination of some of the herbs. There's lots of herbs that are excellent for osteoarthritis. I'm selecting ones that I can consistently get available, that I can use as foods, that I can advise as foods, and that I have a clinically good history with. It's part of my training. So they're not exclusive. I have them arranged in products, but you don't have to get them. You can use them in any form that you want. They come in teas, tinctures, capsules, and then there's topical applications. And so there's lots of different ways of using the herbs. So what herbs am I going to recommend? Devil's Claw, Boswellia, Feverfew, Silver Birch, Chamomile, and Bacopa. And if I want to sound intelligent, that would be, or Latinish, if you like, Harpagophytum procumbens, Boswellia serrata, Tanacetum partheneum, Betula species, Chamomilla recurtita, and Bacopa monieri. I love the sound of all of that, I have to say. It really does something for me. I think it's just a beautiful Latin language. It's the practicality of it is that it means that everybody is talking about the same exact botanical entity, which is quite important when you are buying herbs from externally. They still have to be. Other herbs that I'll be talking about in the infusion, they're the ones in tinctures, is willow bark, dandelion, root, rose hips, red clover, burdock, horsetail, celery seeds, and peppermint. So Salix species, Tarax rad, Rosa canina, because it's the dog rose, Trifolium pratense, Arctium lapa, Equisetum arvensis, Apium graveolum and Mentha piperita. Lovely. Sometimes the problem with teaching and that you can't see anybody is that it's hard to find a place to pause. Some of the foods that I'll mention now, in case I don't get time at the end, because we have a lot to cover, are turmeric. Woohoo for turmeric, does loads of things. Nigella seeds, anti-inflammatory and essential fatty acids, celery seeds, black pepper, and capsicum. The celery seed is a very good addition to salt substitution and taste. And eating celery as the vegetable is also very good as well. Eating all vegetables is good as well. I did bring balloons, and I thought I had loads of time to prepare, but I actually ran out of time. So I'm going to get you to imagine, or I can do a little bit. That's all I need. I want to talk about the interstitial space and the extracellular space. Now I have to keep reminding myself what the difference is, and even then it's kind of hard. You're trying to imagine a barrier that isn't there and a different space that isn't there, because in fact they're continuous with each other. So I'm going to use a couple of balloons to demonstrate. The interstitial space is the space where the metabolic actions take place. It's where all of the exchange happens. From the blood, it crosses through the little tiny pores in the single cells and the capillaries. A lot of things in solution go across the membrane. It then meets a membrane of another cell. And the space between those two is the interstitial space. So you can't see it. In most of this, even the extracellular fluid, as it starts out, you can't see. But if you can then imagine another cell, I should tie into a knot. It's easy to get them blown up. It's harder to tie the knot. Always. No. And the importance of this is that all inflammation, everything that ends in itis, starts in this space. And it's accumulation of stuff in this space. So that's why this approach is relevant to everything from prostatitis to osteoarthritis to even depression. Up until 2015, they didn't realize that there was a lymph drainage system in the brain. And it's extraordinary to think that it's like building a house without dealing with clearing this space is about the input of fluids, the distribution of fluids, and the excretion of fluids. So not taking care of this space is like ignoring your water supply, your drainage, your distribution pump for all the fluids, and your sewage when you're building a house, which isn't going to work very well. Okay. There we go. So extracellular fluid is where these cells join together, and there are little spaces kind of at the corners, and in there goes the small collection vessels for lymph. If this is not cleared, drained, or if too much is put into it, like the nitrites into the river and the water system. So if all of that doesn't happen, isn't drained properly, you're going to end up with overheating in this system. In fact, it can be a mixture of overheating and overcooling. So the exchange of nutrients and from the blood into the cells, this is a blood vessel, this is a cell, happens at that space. And then the drainage of 10 to 15% of what drains from here to here is collected by a collecting system of the extracellular fluid. So the extracellular fluid includes the interstitial fluid. And that's an awful lot of what constitutes inflammation in the body. So it's the herbal basis of many, many conditions that are identified under diagnostic systems at the level of organs. So, okay, very important. That's why when people ask a herbalist, what do you use for migraine, or what do you use for high blood pressure, or what do you use for eczema? It's different for everybody. And if you don't have that collection system right, and you don't have the digestion right, I would say digestion and then congestion. If you don't deal with those, well, then the symptom in the organ or the tissue is just the peak point, like the iceberg. So it's just the top of the iceberg. In our case this evening, we're talking about it as osteoarthritis. Okay. So when I say heat and cold, if you get an acute flare-up of arthritis, which many people are experiencing at the moment because it's changing seasons, and particularly a day like today in Ireland, where it's sunshine and raining and sunshine and raining and the weather isn't settled. Ireland is very damp and generally quite cold, very wet. Lots and lots of Irish people have osteoarthritis. There's a huge genetic impact, but genetics is a tendency. Whether or not and how much you express, it can be affected by many other things. I think one of the reasons, and this is my opinion, one of the reasons why these inflammatory conditions are so common today is because we have foods that are laced with a lot of herbicides, pesticides, biocides, accelerators, retardants. So there's a lot of added environmental synthetic factors that we didn't have to deal with. Xenoestrogens are one important part of it. We didn't have to deal with a long time ago. Not that there was ever a time in Ireland where we didn't have arthritis, let me say. So I'm going to talk about chamomile, which is a digestive, a nervine, and antispasmodic. Bacopa, which is analgesic, antispasmodic, anxiolytic, nervine, and it improves cognitive function. Now, one of the things with any kind of chronic pain is you get poor sleep. Then as a function of that, you get low energy and poor mental functioning. It's a very common complaint of people who suffer chronic joint pain. Now, all of these herbs have some scientific evidence. I actually was surprised to find that there wasn't one of them that I couldn't justify along scientific grounds. Most of the reasons I'm using them is not because of the science, it's because we've learned over thousands of years since prehistory that if we're sore in our joints, that these herbs are helpful. Some of them are adapted to the 21st century, where there's a lot more cleansing, depurification, detoxification as an aggravating factor, which is enhancing the expression of the genetic tendency. If you want the full slideshow, which I prepared here, I can send them to you with all the references if you just send our email, and we'll have the email address at the end. So that was the boswellia. I'll also talk here a little bit about dandelion. Let's see. I can let that when I come to talk about dandelion. Just hold on 2 seconds. Okay, I actually have the wrong slideshow. Will I go and look for it, or will I? No, I think I can keep going. Yeah, I think that's probably better. But I updated all the references yesterday. That's why I wanted to refer to the newer slideshow, but I didn't realize that. So if we go back to the dandelion root is, no, we're going back to devil's claw and boswellia. Boswellia is anti-inflammatory, antispasmodic. It's also useful in ulcerative colitis. Just to give you that broader inflammatory pathway, it is a resin. It's from it's also known as frankincense. It is particularly good for an anti-cancer effect, an anti-inflammatory effect, antispasmodic, and just general all-round anti-inflammatory. Devil's claw is from South Africa. It's called a devil's claw because of the shape of the root. It is one of the best known. There's one of the Cochrane databases, which is one of the best reviews of this science in terms of systematic reviews and meta-analysis. Points to devil's claw as being one of those herbs that have the most evidence for an anti-inflammatory and analgesic effect in low back pain. No reason why it wouldn't have the same effect for osteoarthritis. It's a small number of people can get a little bit of tummy upset. I've 4 or 5 over the last 20 years, and in which case just halve the dose and try and build it up gradually. The next herb I'll talk about is feverfew, which is Tanacetum parthenium. Again, an anti-inflammatory, more recognized for its use in migraine, but the effect on the anti-inflammatory markers, antioxidants, are all the same as they would be for migraine. It may have an effect on the vasodilation, vasoconstriction influence as well. But it's this, and it also has an anti-helminthic. And when I started learning herbal medicine, and I was going to lectures in Middlesex University where I did a BSc in herbal medicine, and they were saying that migraine is good for arthritis, or feverfew is good for arthritis and migraine, and divilonol knows what else. And what my skepticism was up to here. I was kind of like, how can something be that useful for such a wide diversity? But it's because there is a wide diversity of constituents. So the constituents that might be particularly useful for migraine might be different from the constituents that are very useful for arthritis. But as well as which, because we're dealing, it's only in the last 10 years of 20 years of being a herbalist that I've realized that all of these effects are on this background terrain, and the condition of the interstitial fluid, extrastitial fluid after the digestion, and then the tone of the fascia also makes a difference between one person can have very knobbly joints and they're not that painful. Other people can have hardly any signs of osteoarthritis, but in fact they have very painful joints. And some of that is quite likely to be the tissues around all the joints that are too tight and tender and painful. So, which is a good time to remind people to take vitamin D, especially during this pandemic, but also sometimes, especially for older people, for seniors, if they don't have enough vitamin D, because we're less effective at translating it into effective vitamin D from the sun. So if we don't have enough vitamin D, then you can get weakness in the muscles, and the muscles can be sore, and that can lead to falls, and people think it's the arthritis. So there can be a double whammy with low vitamin D and arthritis. Silver birch, I always think of silver birch as a water tablet. It's a water herb. It has a large amount of sap in the silver birch that rises in the spring, and it's a wet, watery, not very hard wood, and I always think of it as flushing through, as a depurative through to the urinary system. Chamomile is antispasmodic. It's good for the digestion. 1/3 of Irish people have problems with their digestion, and many of them will have overlapping conditions like osteoarthritis. It's also antispasmodic, and it's also calming for the brain. And the last herb in the tincture, let's see if I have it here. This is the muscular joint tincture. Up yesterday, I spent yesterday learning how to describe all this so that you understand what effects they are having and how we might have a blended effect. Because that's what the herbal blends are, because otherwise there'd be 5 or 6 different packets of capsules. So it's a convenience, and it's because people came in and asked us about. Tara is here with me this evening, and it was for the staff. When they came into the apothecary, they say, oh, my joints are very sore, stiff in the morning, I can't get going. When I get out of the car, my joints are stiff. So I put together these blends so that it would take all the thinking. I don't expect you to be a herbalist, so I've just done the thinking for you. So the bacoba is, again, it's an anti-inflammatory, and it's also particularly good for cognitive function. And again, for this, it's age-related joint pain and stiffness. So it's overlapping with that. It's taking into account who's most likely to use these formulas. So, and the same reason that I say that it's very good for cognitive function, because that's what a lot of the research shows. But I find with research that what they do is somebody thinks this is a good idea to research, and they do research on it. And then somebody else is looking for a topic that's likely to get funding. And they go, oh, there's this piece of research. Now I'll see if I can repeat it. And then somebody else finesses it. So you end up over about 5 years, you'll find that there's a huge amount of interest in science on a particular aspect. Now, often that's because they're trying to extract a constituent which they can use for a disease in a pharmacological sense, or they're looking for a green bullet, a magic green bullet instead of a magic pharma bullet. And I wish I could find one, but I can't really. So um, they don't exist. It's any more than non-steroidal anti-inflammatories are a magic bullet. I will say that non-steroidal anti-inflammatories, you want to, and paracetamol, you want to avoid them as much as possible, as often as possible. Not because I don't like pharma, or I don't like pain. I don't like people to be in pain. But relying on the non-steroidal anti-inflammatories or paracetamol actually does underlying damage to the organs that are part of protecting you from the process of the arthritis to begin with. And that's evidence-based in terms of damage to the liver with paracetamol, to the kidneys with the non-steroidal anti-inflammatories. Undisputed is the fact that 16,500 people, at a very conservative estimate, die every year in the United States from the effects of non-steroidal anti-inflammatories. And you kind of go, really, how come heads aren't rolling? How come there aren't, talk of that this is outrageous? Well, I don't know the answer to that. People still think that these are benign things. They are very useful for a dental abscess, for something that isn't coming back, for post-operative pain, for an occasional severe headache, and they're probably necessary for migraine or for incapacitating period pain. It's not that you never use them, but arthritis is a condition that doesn't go away. You wake up every morning with it. Maybe you get a break in the summer. So taking non-steroidal anti-inflammatories or paracetamol, you want as little as possible, as often as possible, because once you've taken them, the effect of 2 to 3 hours, and then it's gone, and then you're not benefited. There's no therapeutic benefit from using them. The other reason you might use them is for a specific event that you want to attend and you want to be comfortable. It might be a graduation or a party or a presentation that you have to give. It could be something like that, in which case that's fine. It's all fine. It's all your decisions. So see how that rests with you, is what I would say. So don't take them by default. So at the end of the tea and the tincture, we'll go back and look at what might make you might deliver on all of the assertions that I made at the beginning. So this is a tincture. A tincture is a bottle of herbs. I can't quite get the lighting right this evening. A tincture is a bottle of herbs, right? Which has all of those herbs in it. And generally it's taken 5 ml 3 times a day with a small amount of water or a large amount of water. Here's a tip for taking any tinctures. It's to put them in a small bottle, like maybe even that size, or even half that size. That's 100 ml. Add the day's dose, which is 15 ml, add water, put the lid on it and shake it. And then at breakfast time, you knock back a third. At lunch, you knock back a third. And in the evening, you knock back a third. And for people who are taking tinctures on a regular basis, it's very hard to assure compliance if you don't do that. The other thing I'd say is, does it taste nice? No, I had a shot of it today at lunchtime because I hurt my knee at the weekend. And I can tell you that it tastes absolutely terrible. I console myself, and I hope you will console yourselves too, by saying that bitter taste is part of the benefit. That bitter taste is part of settling the balance between the fight or flight and relax. Okay, so if you're in pain, you're automatically in the highly discomfort feeling of being alert in an unpleasant way, to life's experiences. So that bitters effect. There's bitters in the tongue, there's bitters in the mouth, there's bitters all the way down through the digestive tract. And what they do is they help balance that nervous system. So I'm sneakily making a difference to other systems in the background. Like I'm treating your arthritis, but the chamomile settles your digestion. I'm treating your arthritis, but I'm also improving your mental cognition. So these are the side effects. They're quite nice ones, I think you'll agree. So bitter taste, bitter food, all good. Okay. This is the tea, and we have these. They're in sachets, 3 teaspoon sachets, or they are loose, like here. Oh, that's another suggestion actually. They're available loose as a tea, and it's 3 teaspoons a day, or we have them in a sachet of 3 teaspoons in each of those sachets. So this is 14 sachets, but it's the equivalent of 42 tea bags. Again, it's about compliance. For the first 15 years, I kept saying to people, use the teas, use the teas. They're less expensive. They don't taste too bad. No. We're junkies on tea bags, okay? And I understand. I don't like fishing out loose tea, and it's messy and all the rest of it. So I've solved the problem. So this whole presentation is about solving the problem for you, okay? So this is easy to take. I'm going to tell you what the tea is. Nothing in this is secret. I don't have any secret formula. Everything here, you can go and order your own tinctures. You can mix your own blends. You can enjoy herbs. That's what I'm selling: enjoyment and benefit from herbs. So these ones are willow bark, dandelion, rose hips, red clover, burdock, horsetail, celery seeds, and peppermint. So willow bark, I don't know if you all know the story of willow bark. Willow bark is one of the herbs that are very rich in salicylic acid. And this is the original aspirin. There's an important difference. They later added an acetyl group, and it's the acetyl group that causes the digestive problems and the bleeding and all of those side effects that we don't want. So willow bark is full of salicylic acid, but the amount of salicylic acid isn't the full effect of the analgesic and anti-inflammatory effect, because if you gave exactly the same amount of salicylic acid in a synthetic powder, you wouldn't get the same benefits of measurable benefits as the anti-inflammatory effect of the whole herb. And this is a very important consideration. I always use whole herbs, and that's important when we come on to turmeric later. So willow bark is the original and the best, without the side effects, without being worried. You might, and I think I even have on the slides, I can't remember if I took it off, that it may be a problem with causing aspirin-induced asthma. I've gone into this very carefully. I've looked at all of the research. It's a theoretical consideration, never been reported, no case histories. And it's so overlooked by the medical profession, even when it's caused by aspirin and non-steroidal anti-inflammatories. There's a lot of people out there who are using inhalers alongside a background regular doses of non-steroidal anti-inflammatories. And if they stopped the non-steroidal anti-inflammatories or aspirin, it would actually cure their asthma. So I'm not going to raise any alarms until somebody gives me some evidence. So if you have any evidence, let me know. So dandelion root shifts bile. It makes bile and it shifts bile. Anything that shifts bile will improve the laxative effect, and will have a laxative effect on the gut, and it will, alongside high fiber in the diet. Now, fiber in the diet is very important, and I suggest using ispigula husks or psyllium seeds. They're neutral, alongside skins of your vegetables and lots of other things, healthy things like lots of vegetables. And when you are eating your vegetables and cooking them, leave the skins on. Peel them. But if you buy organic carrots and don't peel them, you won't find that they're any more expensive. Okay, and the same with potatoes. So dandelion has a laxative effect. You want it with fiber, and the more you clear through the sweat, through the stools, and through the urine, then that all clears the decks from my balloons. All right, that's the backlog pressure. So you want to improve the collecting system, and you want to improve the distribution of all that's collected. And that's how you do that. So dandelion improves all of that by flushing things through the stools in particular. It also improves the enzyme function in the liver, which is an added benefit. Rose hips are antiviral. They also have a beneficial effect on high blood pressure. There's research. It's also rich in vitamin C, which is useful for the current times of coronaviruses. So good for the anti-inflammatory effect here in particular. Red clover, Trifolium pratense, is the red clover that you see in your fields, edge of your roads. It's the pink one. It's slightly sweet because the bees like it, and it has two effects. It improves the flow of lymph, according to traditional medicine. Very little evidence for that, but what there is evidence for is an anti-cancer effect. A small amount of evidence. There's not a large amount of evidence for any of this, but the small amount of evidence that is there shows that it is useful, and it's traditionally used as an anti-cancer effect. Now, I would say that anything that improves this depurification and detoxification at the level of the interstitial fluid, and especially by draining lymph, would be helpful for as an anti-cancer. So is a diet rich in vegetables. I would always much rather tell people what they can do rather than what they can't do. Add things in rather than take things away. So burdock, there's a very recent article showing the benefits of burdock in arthritis or for arthritis, which it's been available since I last updated the research for this. I think of burdock as I'm sitting in front of the keys of my computer, and you know that there are some people who have a little baby, Mr. Henry, that actually hoovers between the keys. Okay, and the interstitial fluid it's another good analogy. The burdock is like a little hoover that sucks the fluid from between those cells and delivers it to the lymph. Now that's a traditional understanding, but it's backed up by recent research actually in arthritis. Horsetail. Now horsetail is very rich in minerals. It's a herb that goes back to the time of the dinosaurs, along with ginkgo and a few other herbs. It's the mineral rich. It's anti-bleeding, and it is drying and toning and astringent. So all of these networks are my balloons. If I go back to my balloons, actually one of them has shrank, which makes it a bit more like this one. This one is a bit more like a blood vessel now. So each of those, where those cells are connecting, they're one cell thick. So if you have something that just, when you drink black tea, you get a puckering on the inside of your mouth. It's like a drying effect, an astringency effect, and tightening. So if you can imagine these pores become more effective. So less, one reason why there might be congestion in here is because there's too big gaps and an inefficient, an overloading of that space. Okay, it depends on, there's a pressure difference between what's in the blood vessel and what's in here. So it's that pressure difference, but it also depends on the size of the pores. So if you can imagine that, I like imagining these things. So when I'm thinking of the herbal blends, I'm thinking I want something to tighten and dry and nourish. All right, so horsetail would come into mind when I want all of those things, those effects to happen. Horsetail again is available from our hedgerows in deep ditches, and the edges of rivers is where you'll find them. Celery seeds is literally the seeds from your celery plant. And again, there's traditionally it would be used as a diuretic. So again, we're pushing through the clearing of those spaces by clearing the body. Okay. One of the reasons I don't like just adding supplements that have simply have anti-inflammatory, antioxidant profile is that that's just adding something else into this congested, overstuffed space without clearing. So that's why the digestion and the decongestion are so important. You're clearing the palate in order then for the dilating blood vessels and opening up to oxygen and anti-inflammatory. It's only then that they can get a chance to work. So running all of these herbal actions together, they don't give you an instant hit of pain relief. They give you a cleared background terrain. The terrain is that the tone and the congestion in that background. Very hard to describe these because they're concepts, but they're very realistic concepts. It's actually they fit the physical laws, but they do that as a whole rather than taking each particular aspect of it. So celery seeds are depurative through the kidneys, and then peppermint, it's a tea. Partly the peppermint is there to make it taste a bit better, but it doesn't taste bad, I have to say. The red clover, the horsetail, the celery seeds, dandelion's fairly neutral. The willow bark is a bit sharp, and the rose hips are fairly neutral. So it's a tea that I was surprised that it was good. I don't put the teas together primarily for taste. And the peppermint has an analgesic reaction, traditionally used for analgesics, and there's some evidence for justification of why that might be. But it's also good for the digestion and has the analgesic action. So wait till we see. Looking after arthritis is very much managing a background terrain for heat and cold. Most of the time, background osteoarthritis flare up. It can be, you can have, it can be heat. Now, I don't need to tell you that because you know that already. So in both cases, the strategy will work. I'd probably use more topical agents. Are we okay?
You've got loads of questions coming.
Oh, loads of questions.
Yeah,
okay.
And there's a question there on YouTube
and
as well.
A question on heads or hypermobility. Okay. Heads and hypermobility is a little bit too specific. Yeah. To answer, certainly hypermobility leaves one prone to damaging the joints, which can later present as osteoarthritis. All of these strategies, particularly the tea, would be very good with the horsetail, celery, dandelion, willow bark. Yeah, certainly the horsetail, okay, would be very good for that. I find that it is it's got much more common. Okay. Parish has sent me hi. Suspected osteoarthritis for a few years, damage to his shoulders, pain on hands. Yes, if you have osteoarthritis, you are more prone to tendon damage and injury because they have pain. Nothing showed up on X-ray on the hands. No, that's not unusual. X-rays and osteoarthritis are a very poor indicators. And in other words, if I went up the local shopping street and X-rayed 100 people who of the age of 60 or good 20-25 would have evidence of changes. A lot of them wouldn't have pain. Some people with no changes will have pain, and it doesn't indicate the degree of pain, obviously. Any of these, the blend and infusion together, oh yeah, when to use the blend and when to use the infusion. They're designed to go together. If you're in the very early stages of mild arthritis, but you know your mother had it before you and you're heading in that direction, just taking the tea. But you're talking about taking it for 5 years, the rest of your life. I have one good friend who has been taking the teas and the tonics for 15, 20 years. And if I would say, given her family history, the likelihood of her maintaining the function that she has is extremely small. Okay, and going on my own clinical experience for the 20 years before that in general practice. So so, and then if you have a mild arthritis and then you get an occasional flare up, you can use the tincture for the flare up. If you have moderate to severe arthritis, I would say treat yourself. You know, and if you think you might need this long term, you might want to make an appointment, because you might want to take other conditions into account. You might need more work on the digestion before we start the decongestion. We do a kind of a whole body perspective rather than just my joints are sore. And then you find that somebody has, you know, had a heart attack 5 years ago and also has a strong family history of cancer, and they have, so you're changing the blends according to, and you might change them according to the seasons as well. Your medical herbalist is an ally that shares your journey and your concerns and why things are happening to you at this time, at this moment. So that's when either or both or an appointment might be relevant. Post-viral syndrome with polymyalgia and arthritis. That's different. We always go back and treat the first thing that was the presenting fact. And for you, the treatment a lot would be antiviral treatment, but also looking at why your immune system was so overwhelmed or underwhelmed, or why you were vulnerable at that time. So probably, and depending on how long it goes on, most people are recovering, you know, within 3 to 6 months. It's a long time, I know, but depending on how long it's been going on. If you got it with the first wave of coronavirus and it's 18 months later, I would definitely say have an appointment. Otherwise, it would be, you know, even the imitone, I don't think would have enough for your joints, so it would probably mean making an appointment. I hope I answered your question, Parish. Have I answered all the questions, Tara? You said loads of patients. Okay. Oh no. Okay. Here we go. Diagnosed with polymyalgia. Tried both pharmacy and herbal medicine and acupuncture and matcha, but still crippled and getting worse. Any suggestions? Oh, Jar, I'm so sorry to hear that. I don't know how long you used the herbs for. I think several months. Using the herbs is long term. I don't know whether you used herbal medicine and acupuncture and massage at the same time, because they would complement each other. When you do things one after the other, sometimes not one of them by themselves can hold on to the whole picture. And they can certainly be complementary to each other. So I don't know what to suggest, really. I probably have to see you again, Ger, to see if I think there's a space for what I do or what anybody else does with various, you know, people that I know that offer therapy. Polymyalgia often burns itself out after 3 to 5 years. So it doesn't mean that this will go on forever. I don't know if your ESR is still raised. So there's a lot I don't know. If you want to send me an email, Jar, with more information, I'll do what I can for you. Dandelion and bile, if you don't have a gallbladder anymore. If you don't have a gallbladder, it's even more of a reason to take dandelion. And that package there actually is a combination of dandelion coffee and cocoa nibs. And you put that in your coffee bean grinder, and I tell you, it's nicer than coffee. And the reason for needing more dandelion is that you don't have the spurt of bile to cope with your meals. And the reason underlying the gallbladder being diseased in the first place is still there, even though you don't have the gallbladder. So there are two reasons. Your shoulders going into the back of my neck. a lot of people have arthritis aggravated by very tight fascia. Fascia is the connective tissue that surrounds all the muscles. And if you go to a massage therapist and they go, oh my God, you're like a brick, right? That's the fascia. Epsom salts baths are very good, and stretches, but not like doing this. It's the stretch that I advise people for the neck is it's a meditative stretch where you go that pace, and I'll speed it up. And then when you get to the end, you breathe out and you drop, and you breathe and you drop, and you drop your shoulders, and you do that for several rounds of dropping, and you do that with all the ranges of your neck movements. And you'll find that, as one patient said, you're no longer wearing your shoulders like earrings. So try both of those tips. Regular turmeric. Now turmeric, I said about there's a huge thing at the moment. These things go in and out of fashion. I've seen so many of them, of curcumin. Curcumin isn't absorbed and bioavailable unless it's standardized or processed in some way. And the reason for all of these standardizations and isolation of constituents and putting them back in again and doing all of this is that process can be patented. And once you have a patent, you have a business model which is different from just the curcumin plant, the turmeric plant. I've gone into the understanding of all of this, and the bioavailability is a very narrow definition of the amount of the constituent in the blood 20 minutes after ingestion. Now, there's increasing and growing evidence that herbs are absorbed not just into the bloodstream. They're metabolized by the microflora into constituents that won't be the marker that you're looking for. They're absorbed into the lymph system. They're absorbed directly into the tissues, the skin lining the digestive tract. And all of these are the body's delayed release mechanisms that we all have as we're given. Okay. So I don't buy these, I don't buy them, but I don't buy into all of this patented constituents. And if you want to buy turmeric, if you go to an Asian shop where they have a big turnover, get organic if you can. And in Asia, the average amount of turmeric eaten per day is like 3 to 4 teaspoons. So you can use that. Always take it with a fatty meal. There's a small piece of research which again has been greatly magnified because somebody picked it up in the media and it went into kind of like urban myth. But black pepper is very good in its own right. And there's a possibility, because they're often used together and we have a lot of wisdom before we started redescribing things as a science. Science doesn't make, when they say the science of knowing something in the natural world, they haven't made it, they've just described it in a scientific way. Okay. Raynaud's needs a lot of, the turmeric would be very good, cayenne, but the nettles are coming to mind, ginkgo. So it's more a vascular and autoimmune condition rather than just an osteoarthritis, rather than just the thing. Okay, I think that's all. So I said that the genetics accounts as a genetic element in about 60% of arthritis. And for those, if you have a knee pain on the right hand side and it's bad enough so the surgeon recommends surgery, that's great. And it really, this kind of surgery can really make a huge difference to people's mobility. But if you haven't changed the background of congestion, decongestion and digestion, well then, according to the laws of physical energy and ecological systems, that heat and inflammation will just go somewhere else. And it might go to somewhere that you can't replace, like your fingers. If you have, I have a brother who had a rugby injury in his hip, and it alone, singularly, had a problem with arthritis, and he had to have a hip replacement. That's really secondary to the old injury. I would still, of course, advise them to eat lots of vegetables and turmeric and whatever, because they're good for us in any case. But where you have one hot spot, it's your weak zone. It's where your body kind of goes, not comfortable, not comfortable, not comfortable. There's an injury. So I'll settle my unhappiness in that injury. But it is still a warning sign. Our symptoms are there to put manners on us, really, to kind of make us aware. The one thing that helps us change our habits is pain. Okay, you're not going to be surprised if I say cut the sugar, cut the sugar, cut the sugar. Sugar and inflammation, absolutely. I had a dental abscess once, and I had sugar, and 20 minutes later, pain. A while later, probably for dessert after the next meal, or maybe some biscuits before bed. This was a long time ago, but I can remember thinking, God, nobody taught me that at medical school. I think I was in my 20s or 30s. And 20 minutes later, I wonder if that's related. And I checked it out the next day, and it was 20 minutes later, inflammation. So I have it on first-hand authority. That's what you call the science of n equals 1. So I hope I'm going through all of that. I have helped you to, let me get my checklist, have less pain, better sleep, more energy. Anything that helps your pain gives you a better mood. Hopefully you'll be less inclined and less in need of taking medication. The things like the horsetail and the dandelion, just the nutrition itself will help maintain joint structure and function. And with all of this, that if you are in moderate to severe, you might be able to delay or even avoid surgery. So I think that's plenty. You've all been very, very good audience. How can I tell? I don't know. This is strange times that we live in. Somebody else has put in a damaged AC joint. Bernie, at rugby, I have given him devil's claw and turmeric, but how often I should give him to take it? Usually on a supplement, it will say, and if he's a perfectly well 14-year-old, you give him the maximum amount. The turmeric, whatever is the equivalent of 2 teaspoons twice a day. And turmeric in just a capsule is the amount that fits in that capsule, unless they've altered it. 2 teaspoons twice a day is generally the amount taken throughout Asia. The devil's claw, it should just say on the supplement. And if they're from us, it's two capsules twice a day. Nerve pain following discectomy and decompression at 15, 4 years ago. These are very somebody has a constant burning nerve pain. No, that's different. That's different from osteoarthritis and would be a whole other area. Topically use St. John's wort and comfrey, and add in peppermint oil. There's good research evidence for that, and see how you get on. But there's more to it than that. Depends on getting your digestion right, getting decongestion right. All of these things help. But they wouldn't be specific. See, I'm very cautious. If people are not likely to benefit from a medicine that costs €13 a week, $13.50 a week, and it's not specific enough, I don't advise it, and the teas are about €4 or €5 a week. So, they're about €8 a week. So, always, but we can do that as well, or a mixture. Email is support@drclare.net. Thanks, Parish. Very practical. So I hope that you all feel you have a bit more of a handle on it. As I say, all of the are beneficial. You can use your own, make your own teas, whatever. Talk to the staff. Tara is here tonight. We have a range of nutritionists and herbalists. And anything else you want to add, Tara? Thank you for your
If they
support.
want to email tara@drclare.net for the slides, a lot of people are asking for them.
Yeah.
And also if they want to like us on Eventbrite and Facebook and YouTube, they'll get notifications for any more talks and lots of interesting things.
Did you hear all that, everybody? Like us on YouTube and Eventbrite and everywhere. And email either support@drclare.net or Tara specifically at tara@drclare.net.
Yeah.
Okay. I think we have that. And we're Dr. Clare Apothecary. And nice to talk to you all. I love that I'm getting to the point where I can say how we work rather than, I think that's very exciting, new venture. And thank you all for your patience and interest, and take care of yourselves, and bye for now. So I'm building up, sorry.